It's 104.8 Channel 4. You got Sean here hanging out with you this afternoon. Now, we're going to talk about something pretty important right now, cancer awareness. And here to tell us all about it is Dr. Dorai Ramanathan. He is a consultant of medical oncology at Al Zahra Hospital in Dubai. Doctor, thanks for joining me this afternoon.
Thank you very much, Sean. Thanks for having me.
It's a topic which is a bit difficult to broach. It's a lot of people's worst nightmare to find out some bad news regarding cancer. But let's just concentrate on some of the discussion around cancer prevention and things that people can do for prevention of cancers.
Great, yes. I think that's the start, really. I think the more important in cancer management is cancer prevention. And I think most of the time when I talk about it, I concentrate first on the diet. And what we know is diet has the directly or indirectly relation with increasing the risk of cancer. What we see is people with obesity have a very high chance of developing about 10 to 13 different types of cancer, to be fact.
Wow.
And we also know that processed food has a very high chance of contributing to developing cancer. So I think concentrate on diet first. Then, of course, moving on is exercise. I think regular exercise is going to sort of reduce the risk of occurrence of cancer, and also that it reduces obesity in a way, and that's helpful. Apart from that, we know vaccination can help. That's to prevent, we have this cervical cancer vaccination, we have the hepatitis and various other vaccinations which could be also very helpful in early, prevention of cancer, to be frank. And lastly, more important is the screening. Screening. People should be well aware of the screening programs that's available. And I think we should make use of this so that they can sort of find out if there is any problem at an earlier stage.
Now, you mentioned diet there and exercise. Obviously, people from different regions of the world have very different diets. Now, you've worked in the NHS for almost 18 years. What difference are you seeing in patients from, say, like the UK and the Middle East? What are some of the challenges and some of the differences there?
If you want to concentrate on the diet, I think the UK is in a fairly, the fit patient group, actually. And I guess it's changing over the last decade all over the world. The junk food is becoming more common. And you tend to see a lot more processed food being used here. I mean, I think the UK is not too far, to be frank, but also, you see more processed meat being used here rather than in some things like the UK. And because there is a GP service who's also looking after the care of the patients in the UK, they seem to be slightly better off than the Middle East population, saying that, it's bad everywhere at the moment, frankly.
Okay, now there is some cutting-edge treatments which have recently come to light in treating cancer patients and managing side effects. Let's go before and after. What's kind of changed in recent times, Doctor?
Yeah, it's good to know. I mean, I've been practicing this for 15 years, and when I was going through my training, they said our sort of generation is going to be something which is going to see a massive shift in management of cancer. Now, when I started, there was hardly any treatment options in to manage these cancers. The one or two options, mostly chemotherapy and not well-managed side effects. What's changed now is we have precision medicine. We have very much a patient-centered or patient-unique treatment options, and it's personalized treatment, to be precise, actually. So we have genetic sequencing which can tell us what treatment works best to the patient, but also that these treatments come with lesser side effects, manageable side effects. And so, it's a big shift. And I think things are moving forward very quickly. Last decade, I see an exponential sort of improvement in managing cancers. I'm sure the artificial intelligence is going to play a role in sort of making things even better in the next few years.
Fantastic. We're going to talk more with Dr. Dorai Ramanathan. He is a consultant of medical oncology at Al Zahra Hospital in Dubai. It's 104.8 Channel 4. It's 104.8 Channel 4. You got Sean here hanging out with you this afternoon. Now, we're going to talk about something pretty important right now, cancer awareness. And here to tell us all about it is Dr. Dorai Ramanathan. He is a consultant of medical oncology at Al Zahra Hospital in Dubai. Doctor, now a lot of people talk about artificial intelligence just on that. Is artificial intelligence going to be a big thing in this field, in cancer research, cancer prevention?
Absolutely. Actually, I think you keep hearing on TVs, radios like yourself and every other place that we are now able to diagnose or even predict a cancer at an earlier stage with the use of artificial intelligence, actually. And this is going to only, the quality is going to only improve as time goes on. So I think we see it as a very significant sort of shift in terms of diagnosing and predicting a diagnosis with the use of machinery. And also in treatment, it was never easy to find out a target. Now I'm sure AI machine is going to tell us more about the possible sort of downregulation sort of molecules, which is going to help us treat even better.
Now, Doctor, if there's somebody listening right now and, they might not have the best diet, they might not exercise all of the time, they're feeling a little bit worried about potentially having some sort of cancer either now or in the future, what would you recommend to those people listening right now?
I think the first and foremost thing is to be aware of what's going around you, actually. So first of all, body awareness is something that I always talk about. If you find something is not right, do go to the specialist. Number two, as we spoke about, lifestyle is going to be very key. Diet, exercise. Of course, smoking, we all know, is associated with cancer, bladder and lung cancers. So try and avoid these things if possible. Try and avoid the bad things. Of course, improve the diet and exercise. And then, vaccination is key. Screening is very, very vital. So I think do all the right things, and I'm sure we can able to sort of close the gap, we say. We try to close the gap in managing cancer patients. Early diagnosis, make the resources available, and continue in efforts and research.
It is a tough topic to talk about, Doctor, and a lot of people don't like talking about it, but it is an unfortunate reality of our civilization. It's something that we have to deal with. Dr. Dorai Ramanathan, thank you for your expertise this afternoon, and thank you for informing us all.
Thank you very much to all the listeners, and I hope it made some impact and hopefully things can improve, continue. Thank you.
It's 104.8, Channel 4.